Of course, we continue to follow the coronavirus outbreak here in Massachusetts. And to keep you informed, we want to answer some of your questions. WBZ is the only Boston TV station with a doctor on staff. And look at the timing. She's here right now. We're joined by our own Dr. Mallika Marshall at home. Nice to see you, doctor. We received the same question, by the way, from both Marcia and Frank online. They both asked, I keep hearing conflicting messages about masks. Should everyone wear one or not? And there seems to be maybe a little change in this, Mallika.
That's right, and my husband's texting me as we're about to go on air. I'm like, I'm going to be live. You'll listen to my answer. So in terms of hospital-grade masks and those special N95 masks, those really should be reserved for healthcare providers and other first responders who really are taking care of sick patients, and they're trying to protect other staff members, and they're trying to protect other patients. But you're right, it sounds like health officials may be changing their minds about whether the general public should be going out and about wearing masks. And it's not to protect the person who's wearing the mask from getting infected, it's to protect the people around them. And that's because we think that there may be quite a few people out there who are infected with the virus, who don't have symptoms, who are responsible for community spread. And so don't use the surgical masks that the medical folks need, but you can use bandanas or scarves or other types of masks to protect yourself. We'll sort of find out what health officials say.
Interesting. Yeah, I heard that the CDC is thinking about changing its mind on that as well. Holly asked us on Facebook, what is the current backlog of testing and when will labs get caught up so we can get more accurate data?
Yeah, it's incredibly frustrating because, as you know, there have been shortages of test kits. We know that if you do get tested, sometimes you don't get those results for days. Fortunately, the FDA just granted emergency use approval to a company that is producing a test kit that will give you test results within 15 minutes. There are others in the pipeline, so hopefully soon we're going to be able to ramp up testing even more.
Well, the good news is that they're at least up to that, 3,500 a day here in Massachusetts that the governor wanted. Laureen and Gail both asked on Facebook, once a person contracts this virus, does that person build an immunity to it, or can they get it again? We've had this question several times.
We have, and we keep revisiting it because we don't really know. I mean, we know that people who are infected with coronavirus do exhibit antibodies, meaning they do have some immunity, but how much, how long it lasts, we don't know. It could be months, it could be years, but that's also why it's really important that we get a vaccine out sometime next year.
All right, Vinny from Millis asked, what if I order a pizza and a worker accidentally coughs on it? Could I get sick from eating the pizza?
So we don't think that that's a common mode of transmission. It's unlikely that if you eat a slice of pizza that has virus on it that you're going to get the virus. And we know that the virus doesn't like a lot of heat. So if you cook foods, you should be okay. However, if someone sneezes or coughs onto the pizza box, you touch the pizza box, you touch your hand to your face, you could get infected that way. So I would say if you're getting takeout or delivery, take the food out of the original packaging, put it on your own plates, and then wash your hands really well before you eat.
By the way, Amazon packages, when they come in the door, I always hit them with Lysol first. I don't know if that does anything, but it makes me feel a little bit better anyway. Dr. Mallika, thank you so much.
Well, we do know it can last on cardboard.
All right, so
Good
maybe
to see
that
you,
helps. Doctor, thank you so much. Lisa, over to you.
Better safe than sorry.